Hello, everybody. This is Pastor Wayne Moore, Real People, Real Voices. Today, we're at the Marion County Health Department with Dr. Virginia Cain, and we're going to let the community know what's really going on with this coronavirus. And we're grateful to have her in our city, and we hope that you'll pay attention to what she has to tell us about this virus. Dr. Cain.
Hey, thank you, Reverend Moore and Reverend Green. I appreciate you being here.
Thank you for having us. Tell us what's going on.
So let me just say, I think it's just so important for the residents of the state to know how to reduce their risks. And the most important thing in knowing that is know the symptoms of this COVID-19. So if you're experiencing a fever, 100.4 or higher, or you're having coughing or shortness of breath, these are the three most critical symptoms we see with patients who have the COVID-19. And it may mimic the flu. So the flu, you're more likely to see a runny nose or sore throat. You can have nausea and vomiting and diarrhea. But any of those symptoms, please contact your healthcare professional. Or if you go to emergency rooms or urgent care, do not do that unless you call in advance, because we would not want you to be contaminating anyone in the waiting room area. So please call for advice about your symptoms. And for those who have mild symptoms, it is fine for you to stay in your home.
Dr. Cain, tell us how important it is, because there's a lot of information out there that a lot of people are not sure of, especially when it comes to the faith-based community. Tell us what you expect as leaders for us to be doing for our congregants.
So I think that one of the things as leaders in your faith-based organizations, you have to recognize that if you have a significant number of senior members, they are at a much higher risk for exposure to this coronavirus and a much higher risk of developing complications and even hospitalizations. The mortality rate in someone who's older than 60 and they have chronic medical illnesses like diabetes, hypertension, asthma, kidney failure, that mortality is between 10 to 15%. Whereas we look at our children, we so far have had a zero mortality.
Good.
But so important that you keep that social distancing related to those members. Now, Governor Holcomb states that there should be no more than 50 people in a non-essential gathering. But those numbers may need to be lower if you're in that senior population and you're at higher risk for complications and very, very sick as well. And I don't want you 20 to 50-year-olds thinking that, hey, I'm a young adult, I'm healthy. We are now finding a new data released from the CDC that almost 30 to 50% of our hospitalizations are between the age of 20 to 50 years of age. So if you don't want to protect yourself and don't practice good hygiene, you can put others at risk. I can't tell you how many people tell me, oh, doc, I don't need that flu shot. I've never got flu in my life, and I'm healthy, so I don't have to worry about it. Let me tell you, you may be fine, but if you pass that infection to a newborn baby, pregnant mother, or a senior, you're being just so selfish in terms of your caring about other individuals.
Dr. Green is with us as well. Dr. Green, you have a question for Dr. Cain?
Sure. I mean, I know with the rise of the coronavirus, are our staffs, hospitals, et cetera, running into any supply issues in terms of our community?
That's a very good point, and yes, we are. So we're very concerned in just a very short supply of our what we call special masks called N95 respirator masks that we wear. And we're also running out of supplies, just the little swabs that you need in order to take a specimen from a patient. So those are two major areas that we're very concerned about in our hospital systems, even our long-term care facilities, in terms of our healthcare professionals being prepared, our first responders, the ambulance folks, the fire departments, all of those individuals that are picking us up, that is a major concern.
Obviously, this is something we're all going to be in this together. As a community, we're going to have to fight in this fight. Is that correct?
So we're definitely going to all have to be in this together. So the more that we can do to protect ourselves, then we're less likely to infect or expose someone else. For example, I can't reemphasize this enough. You have to wash your hands frequently with soap and water, and I mean for 20 seconds. And if that's not available to you, then you can use hand sanitizers. But it has to contain at least 60% of alcohol or higher for it to be effective. Cover your mouth when you're sneezing with tissue. Throw that tissue in a trash can. Stay home if you are sick. Please don't expose others because you could be contagious. And I know this is tough because it's tough for me. Try not to touch your face, nose, or your mouth because that's how you can infect yourself. In any environment, from whether you're at home, you need to disinfect frequently on a daily basis. If I'm in my work environment, know how to disinfect. Bleach, Lysol are great products, and there are other standard cleansing products that you can use to clean this virus.
Dr. Cain, give us the update on those who have been infected. It's over 10,000 now, isn't it?
So right now, it's actually in the United States is about 12,500 who have been infected in the United States.
This is 4 days, four-day span almost.
So yes, so let me tell you how important it is. When we first heard about this in China, December the 31st, they had 400 cases, December the 31st. They are now up to 81,000 in the cases that are infected. Look at Italy. Italy now has 25,000 cases. Right now, we're at 12,000 cases. In the state of Indiana, we're at 48 cases. And in Marion County, we just got 2 more cases today from yesterday. So we went from 11 to 13 cases so far. Now, you know we've only had 2 deaths, one in Johnson County and 1 death in Marion County. But there are 186 deaths across the country now so far. But what's my worry? What's my concern? That we don't want our hospital system so overwhelmed that when you get sick for like an appendicitis or you have some other emergency that you need, that there may not be a hospital bed for you because our hospital systems are so overwhelmed with this coronavirus. So we don't want to be like China, where the cases went way up so high it exceeds our hospital systems in terms of our supplies and staffing needs. We would like our cases to sort of go up to this level and then kind of plateau and stay like this and then go down. But it all depends on what we call these mitigating measures. So that's why we had to shut down the restaurants, a decision made with Mayor Hotsett and our healthcare professionals, close the bars. Restaurants are fine as long as you can do delivery, open window, pass-throughs. We just can't have a congregation of large numbers of people together.
We have 1 minute left.
Yes.
Tell us what you really want this community to do as it relates to this pandemic.
Listen, we've got a number of seniors out there that may be vulnerable and they need help. I want you to help your neighbors. See if they need any assistance in getting groceries. Watch over them, monitor them, and also know that we have a call center Monday through Saturday from 8 to 5 on Monday through Friday until 12 on Saturday. Call us if you need some resources. The mayor's office has a compass that can provide a lot of resources. And hey, volunteer for those who are healthy and can do it for us.
Thank you, Dr. Cain.
We'll be right back with Real People, Real Voices in just a moment. Welcome back, everybody. This is Pastor Wayne Moore, Real People, Real Voices. We're happy to be here at the Marion County Health Department with our guest, Representative Greg Porter is going to come and give us some information about what's going on as it relates to what he's doing during this pandemic. Greg, good to have you.
It's great to be here, Pastor.
Tell us what's happening.
Oh, have mercy. Well, things are moving very quickly here in the city of Indianapolis and across the state. From our perspective as Senior Vice President of External Affairs, I'm working with the governor and the mayor's office to alleviate some of these situations and answer a lot of questions. As we move forward with this ever fluid situation, we're at the moment, we don't know what we don't know at times. Mm-hmm. And that's not saying that we're not on it, but we just have to flow with what's going on. We're having meetings on a daily basis here at the corporation to get updates and see what's going on at the Rock, to see what's happening at the city of Indianapolis, as well as the state. So we have a huge team here beginning to put out as much information as we can to help our constituents understand what's going on.
Yeah, I think that's good that you're available for the community. So happy to have Dr. Green with us today. He's president of the Concerned Clergy. He's with us. He's concerned about the faith-based issues as well. And so he's going to have some questions for us, and we're going to see what he has to say.
Yes, first of all, thanks for being with us on the day. As faith-based leaders, many of us are concerned that when the wealthy catch a cold, it's the poorer of us who catch pneumonia. And so we see this particular situation as one, what's going to happen to the poor and the middle class? What's in place? Are there discussions being had concerning how we're going to help the average person?
Absolutely, Reverend. And that's been first and foremost with other individuals. And you're so right, a cold versus pneumonia. And that happens all the time.
All too often.
Too often, yes. And I think I've been on several conference calls, like Indiana Sports Corporation has been meeting, but what we're doing is that from my community leaders hat as being a state representative, we've asked the governor to address the underinsured and unemployment insurance that we have in our state. We just came out of a budget about 7 days ago now. And we, at that point, had more money than we thought we had. We had about $2.4 billion surplus. What we've asked the governor to do is to, through a letter through the House Democrats, is to give up some of those dollars to help people that are going to be affected by this. Do away with the CHIP copay, to help individuals that are underemployed. Now they're working 2 and 3 jobs. Now they're really underemployed. They may be employed, but they can't let ends meet where they want to. Asking that we don't do anything that we done prescriptive or be punitive toward low-income people or people are working men and women, and that is so important. We just unfortunately passed the legislation with landlord-tenant. And now that means that landlords can potentially put people out of their homes. And the health department, we've asked for a moratorium on that.
Great.
That would not happen. We're asking that the Citizens Gas or IPL do not disconnect anybody at this point, because it's on March 15th. We asked to move it up at least 30 days, if not more, to help those individuals. We've asked my constituents to talk about not only what's going on in education, but they've also asked about where the food deserts are and how our kids are going to be fed during this time. Now they're out of school. They'll be out of school for a long time, longer than we really think, and where the food resources going to come from. So now, if there's any time that we call on the spirit and the spirit of collaboration and community, this is a time that Indianapolis has to do it in this country.
Without a doubt, because I'm looking at, we have to have things that are going to be sustainable in here. And is there any plan regarding not just renters, but those with mortgages? What's going to happen with them? If I'm working 2 or 3 jobs, now, you know, my job went away.
My kids are home.
What are we doing? Is there anything being discussed or planned in that area?
Right. I know the governor has his cabinet he's working with. We are, as elected officials, are trying to help our governor. You know, and the whole point is that I just hope that people understand this is not politics. This is people. And I hope anything that any of us say, that we know the numbers, that we understand what we can do through the State Board of Finance and at the state level, that we're not playing politics. We're playing the people card. And that is so important. And I just want people to understand that, and the governor. So when it comes to mortgages, you know, they can defray that. We can ask to have that defrayed, put it on the back end of the mortgage. You know, if they can only, if they have to pay $800, and of that, you know, $400 is interest. Okay, put the interest on the back of that $800. You know, so I mean those things.
I'll put the whole mortgage payment on the back.
Or defer the whole mortgage payment
right.
for 60, 90 days, and they can, and they have, and there are these are extenuating circumstances. The mantra out there is end of life, people with OB situation and extenuating circumstances. And these are extenuating circumstances when it comes to addressing the needs of the Indianapolis community and our constituents.
And with our children, yes. You know, in terms of education, et cetera, you've alluded to or hinted that it could be for the rest of the school year. It
could very well be for the rest of the school year. E-learning is good. You know, it's something that started back in, I think it was about 2002. They call it e-education. Now it's evolved to e-learning. We put those things in place through technology, who has moving expeditiously through the airways, from 3G to 5G now. But to get our kids to have education is very important. Some of our children don't have internet services. The libraries are closed. So now we have to figure out how we're going to get the information to our children. And some parents who have to work, some people don't have the capacity to help teach their children. And so now what are we going to do in regards to waiving the 15 or 20 days that the kids can be out of school without there have been something punitive done against them? So I mean, there's so many factors out there now, Reverend Green, Reverend Moore, that we have to deal with from a legislative perspective. But the key point is that we got to continue to look at the psychosocial well-being of our children, of their parents, and of their household in regards to food and other sustainable things that can help them navigate these totally uncharted waters.
Well, I'm an IPS product.
Yes,
and
sir.
So a lot of school systems are healthy. They have the virtual systems going. Children have computers. There's a lot of children in IPS now, because IPS has taken a beating through the charter system, innovation system, and even through the General Assembly.
The virtual system, yes.
Yeah, virtual system. And so some of these kids who were struggling in their particular grade, now they're going to be out with no computer, with no assistance, might have to repeat those grades because of that. What can we do, and what can we talk about to make sure that IPS can be pushed toward the 21st century edge?
It's up to the leadership, Reverend. I'm quite sure, and I haven't had any discussions with the superintendent or any of her cabinet. I've had one conversation or two with school board members who are dialed in and understand the hurdles that lie in front of our children. I would hope that none of our children would be retained under these conditions that it's not their fault. I will hope that we will figure out how to, in the summer, if we have to, do tutoring programs and do some remediation, or do something early to help them move to onto another grade. I can remember as an IPS product, I was in a split 4th and 5th grade. So we had 4th graders and 5th graders, and the 4th graders of us, we were learning some of the 5th grade work to help us move forward. And so I will hope that they talk about innovative schools. These are the times that they really have to be innovative in regards to the educational outcomes and projections.
Thank you, Brother Porter. Thank you so much. This has been a privilege. Thank you, Dr. Green, for taking time out of your busy schedule to be with us. And we're just happy today that we're here at the Marion County Health Department doing what we do to make sure our community is well versed on this virus. We want to thank Dr. Cain and Brother Greg Porter for being with us. And thank you for watching and Real People and Real Voices. Thank you so much. Welcome back. We're ready for the wrap-up. We have Dr. Green is here with us, and one of our producers is here, our executive producer is here, Curtis Baker. So we're going to go into the wrap-up.
Well, first of all, I want to thank you and Dr. Green as a representative of WHMB TV 40 that this is so important to get this information out to our community. And we appreciate that you guys are being the forefront to get this done. But I also would like to thank our sponsors that helped get this show on the air, and that would be the Marion County Public Health Department.
Right where we are right now.
Right where we are now. Appreciate that. Al's Modern Clothing and Shoes, Lee Castle and Crawley, and Fervent Care Christian Academy.
By the way, Dr. Green is sitting in for Brother Jackson today. He had another appointment. We want to make sure we mention our co-host, who does a great job with us on Real People, Real Voices, and we hope to see him real soon.
Right.
But tell us, we had a great show today, a couple of segments. We had Dr. Cain.
Had a fantastic show, and I tell you, it seems like every day things are always evolving. So it's good that we stay on top of information. Information is key. And there's a lot of stuff out there that is misinformation. So when you can get it from the horse's mouth, that is very important. And please stay tuned to our station, because you'll hear more information going out to the community based on what they need to know.
And I think what we can be happy to hear is that she's on it. We're blessed to have, Dr. Cain in our community. Not only her, but Brother Porter as well, working for Health and Hospital, and they're concerned about the total community.
Exactly.
Not only the total community, but Marion County as a whole.
And it's so good that we're all working together, and the faith-based community is partnering, because this is going to take a collaborative effort to overcome this virus.
Yeah, and I think you mentioned that there's going to be a fight, and we just might as well get ready for it, because we're going to need resources that's going to help, and it starts down on Capitol Street, to where we can get these legislators to make sure that they can tap into that surplus and make sure those dollars get out to these communities to help our children and our communities.
We've got to advocate for the poor, those that are going to be moving from employment and underemployment to no employment. If we don't advocate for them, they could easily get lost.
Yeah. Well, this has been Real People, Real Voices. Thank you for tuning in. See you next time on Real People, Real Voices.